Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello, and welcome back to the Sit and Stay podcast, the show where mental health providers learn to keep their practice healthy alongside their patients. Brought to you by RipsyTech, an electronic health record company dedicated to addressing the mental health crisis in the United States. So, as always, I am RipsyTech Product Manager Parker Anderson, and I am joined by the founder and CEO of RipsyTech, the on his way to Vegas, Tom Tarshis. Hi, Tom.
Good on the fly intro, Parker. Yeah, no, good to see you.
Thank you.
It's an exciting day. One of my kids is turning 21, and it's sort of a rare sync of events that allows for a Vegas trip to happen. So I will just go to take him and some friends to dinner. I don't plan to hit the strip with a bunch of 21-year-olds, but it will be fun regardless.
Sounds good. Well, yeah, I'll be interested in hearing how your dinner goes. Well, listeners might be noticing that this episode is coming out 2 weeks after our previous episode. We decided to, just with some current events going on with ourselves, mainly myself, with upcoming paternity leave, we are going to be doing an every 2-week cadence for the foreseeable future, but we'll likely pop back to a weekly cadence on episode release. Not too far off in the future, but we just wanted to clarify that to expect episodes to come out every 2 weeks until otherwise noted. So for this episode, we did want to talk about a pretty interesting concept that you brought up, which was this idea of like widely felt stressful events, kind of like collective stress events. So a good example of that would be like the pandemic, for example. And for you as a provider, what kind of unique challenges that poses when, your patients are coming to you specifically talking about stress related to that event that you yourself are also experiencing. So, let's talk about it. What kind of unique challenges come up with something like that?
Yeah, and normally when you're doing therapy or you're a mental health clinician, people usually come in with, specific issues going on in their lives with relationships, work, symptoms, etc. But there is this, phenomenon that you start to notice as a provider, that when a majority of your patients are all talking about the same thing, it's something to be aware of when it's happening. And then it's a good, the pandemic, it was such a great example of everyone's life really throughout the world was sort of turned upside down by this event. So in addition to helping people with their individual issues, you start finding that everyone is having anxiety, concern, worry about these collective events, and it almost feeds into every single session that you do. So when you have something that you're going to be talking about for a lot of your day with lots of different people, it's something as a clinician you need to be aware of and then do some reflecting on how you're going to handle the repeated theme of conversation that keeps coming up over and over.
So we're kind of going through a time of uncertainty right now. I mean, I think anytime there's a new presidential administration, there is certainly, a time of uncertainty. Maybe perhaps this transition being a bit more uncertain than others. But, I think part of why this is such a relevant topic is because of, some of the uncertainty. And, we see all kinds of different things in the news about what's going on with federal workers today, and it's different all the time, and we don't really know, what the next 4 years is going to look like necessarily. So, how would you say, a time like now compares to a time like the COVID-19 pandemic in terms of, what you're seeing with patients?
Yeah, and I think the reason this was on my mind also is because it was starting to be similar to the pandemic, where almost every single patient coming in for a session, the topic of the divided country, and there has been kind of daily shock headlines that it's certainly different from this fear of death or yourself or your child getting a fatal
Right.
disease. Nevertheless, that uncertainty and worry and how is this going to affect me, one of the most stressful things for anyone to deal with is a job loss and financial insecurity. And that's a theme that has come up with people concerned about their jobs is, hey, if I lose my job, thousands and thousands of people are losing their jobs. That makes it a very competitive job market
Yep.
for the other places that someone with in particular skills could work at. So this is starting to pop up in our clinic and being a theme throughout all of our sessions. And it's almost, it doesn't matter sort of where you are on the political spectrum. Everyone in the divided country and with events happening is having some worries about what this means for them and their family and their future.
Yeah, well said. It's funny because you say all these things, and I'm sitting here thinking like, oh yeah, like I've been thinking about that too. And I think that's why this is such a I mean just the right thing to be talking about right now. So
Well, yeah,
I guess from a
and even
clinical. Oh, go ahead.
yeah, right on that level, right? Right. So more specifically, there's a lot of conversation around healthcare stuff, right? So that's something
Right.
that's going to affect everyone in a clinical field that could create some worry. It's creating worry for patients who are on certain government-backed insurance plans, and then, well, and universities are very worried. And I know your partner sort of is in an academic setting, sort of still in school, but also employee. So
Yeah.
it's just an example of the far-reaching effects of something like this can have on everyone in the country. Yeah.
Yeah, and I mean there have been a number of different events, well, headlines in the news that impact people in all types of different ways. Whether it's certain federal grants being put on pause and then being resumed again, or getting an email about your productivity in the past week. It's different all the time, and I think definitely in the case of my partner and I, like we feel secure because she does have her school insurance. She does also have her employee insurance. So with baby on the way, we are doing okay with all of that. But we know that there are plenty of people who have completely different situations, and I mean, I had a friend who was recently trying to get a job that was with the federal government doing a specific type of work, and he was really excited about it because usually when you get a job like that, you're kind of just set up for a very long time because it's a federal job and it's something that people need you to be doing. And then now with everything that's been going on, it's almost kind of like a relief that he didn't get that job, because then he doesn't know if he would still even have it, because he would have been the first person most recently employed. So it's it's a tumultuous time for sure. I will say maybe not to the point of the original question, maybe not as tumultuous as the pandemic 5 years ago felt, but tumultuous nonetheless. So when it comes to managing this stress, like from a clinical perspective, do you find that like you're experiencing stress, they're experiencing stress? Like I guess how do you manage the like professional boundary while still empathizing with them, because you might be facing the same stressors or sources of anxiety.
Yeah, and I think in multiple episodes we've sort of hinted that, as any type of healthcare professional, there is a demeanor you want to have when working with your patients, and it's if you're I think, although that's true for any job, that when you're having a stressful day or bad day, you still need to go in and be professional.
Right.
Especially as a therapist or mental health clinician, though, I think there's that extra pressure to be calm. Calm. You're still being a good listener. You're thinking about specifically, what these broad anxiety provoking events, bringing that more specifically for what your patient or family's concerns are. And really, it's not your therapy session, right? So if you're feeling a lot of the same things, or have a comment to add about something, an opinion you have or something you read, it's not really the place to be doing that. Of course, I am sort of a believer that some self-disclosure can be helpful, but it is very, you do not want to do anything potentially that could cross the line where your patient, has to give a reassuring comment to you, or feels like you're stressed out, or flips the roles, and that creates the opposite dynamic that you need when you're doing this sort of work and that sort of treatment. And it's also important, no matter where you are, to keep, political, religious, other belief systems that you may have personally. You don't want to ever assume that you know completely those systems with people, and you want to be there again as the listener and someone to reflect items without sharing too many of your own political, religious, or other beliefs.
Yeah, I think you hit the nail on the head when you said, keeping in mind it's not your therapy session. And I, as the person who's not the provider in the room between the two of us, I can only speculate, but I can't imagine that. I guess, like, knowing that you're supposed to be keeping the focus on your patient, you can still do your job and listen to them and provide the treatment that you need to provide them, while not bringing your own, I guess, baggage to the table. So that makes me think about, I imagine, like, a lot of mental health providers have their own mental health providers, maybe not all, but I guess, I just imagine it's helpful to be talking about these things with other people, whether that's with your own mental health provider or with the people in your life, so that you can, I guess, get to that, I don't know if neutral is the right word, but get to that neutral place with your patient, so that you are, you've processed this on your own. You've kind of done your own internal work to make sure that you're not having any kind of impact on your own treatment that you're not impacting the treatment that you would otherwise be providing to the patient.
Yeah, no, and you're totally right here, Parker, right? So, and this is always a concern for people in private practice or very small groups, that, one of the advantages in being with a large group is there's a lot of colleagues that you can talk about these issues with and get support. And, hey, my patient said this and it really triggered this thought and I was having a hard time, that sort of support. Yeah. And then in addition, right, if you're having symptoms that are affecting your work, hopefully you're connected with your own mental health providers, and that's an appropriate environment to get support. And it's ultimately making sure you're doing what you need for yourself, which you're probably telling your patients to do, and making sure that you have the support needed to keep your appropriate professional boundaries and professionalism Yeah, and so what do you, if you're in a private practice or small group and you don't have that, that's
Right.
where you want to reach out to old mentors, to other colleagues. There's a lot of Facebook and other groups of mental health professionals, and there are means to connect and get that support. So that's, it is out there regardless of who you are, but making sure that you take the right steps to get some of that support is important and doesn't always happen.
Yeah, I mean, I think that's some really good advice. What is there any other advice that you would offer to a mental health provider who is struggling with their own, I guess, like how to approach the how to approach the session when you're dealing with these collective stress events?
Yeah, no, and it is all about being aware of where your mental health status is, and are you in a place where you need to take some time off? What is the level of help or support you might need yourself to continue doing your job well? And the danger, right? The danger is that sometimes, and this is again another issue with sort of the private practice
Right.
model, is you take time off, you're not earning any income. So when
Mm-hmm.
you're in a larger group or have a system set up where you've put together PTO dollars and vacation time, then you have a little more luxury around that. But it is this issue where always people will often go into work in not the best state because you ultimately need to get money coming in to pay for your house and other expenses, and that can be a tricky balance at times.
Yeah, I think that fits really well into the episode we did where we were kind of weighing the pros and cons between a group practice and a private practice, and that's certainly something that sounds like is definitely a large pro of being in a group practice. Um, yeah, I mean, with a lot of the time it's figuring out how to kind of fill the gaps of if I'm in private practice and I don't have the collective support of being in a group practice, being able to talk to other people who are also mental health providers who are stressed out about these things, and hearing a lot about the pandemic in session, that, like, how do you supplement that while you're in a private practice? And I mean, I think that's kind of just like one of the ultimate, like, dynamic of being in a private practice is just like, how do you fill in what you don't get from a group practice? I think the money issue of, like, taking time off and not getting paid, that's just the nature of the work in that case. But okay, I mean, this is all.
Yeah,
This is,
yeah. Well, and I don't know if we've specifically covered this on other episodes, and this is very off current topic, but right, there are ways to sort of set up your private practice to actually allot yourself vacation time. So like, here's how much revenue you bring in, but you're going to pay yourself in a manner. So you've got your 10 holidays and 4 weeks PTO, and then if something like this comes up, you're not as stressed about it. I would say that in general, people in private practice don't do that sort of level of planning, and but yeah, that's for another.
yeah, I have like a million follow-up questions that I
Yeah,
could ask,
yeah.
but I'll keep that I'll keep that for a rainy day. Okay, so I mean, any other thoughts on this topic? I mean, it's kind of a quick one, but I mean, it seems straightforward. But I mean, yeah, any other thoughts about just the topic before moving on?
Yeah, no, I mean, I think knowing that this is a topic that's going to be on people's minds, it sort of can help you, being a little more aware of which patients are coming in, and you sort of know what some of the topics and other items that are going to come up are. So taking a couple extra minutes to kind of prep and think about your patients before they come in is usually what I do, especially for patients where, this has been a good chunk of their treatment for the last few weeks. And so I just try to prep a little bit more there, and going over the likely questions and topics and sessions, I think helps prepare you for what's going to happen and gives you that little extra help in maintaining your professionalism.
Very well said. All right. Well, let's talk about, do we have a mental health business moment of the week this week?
Let's see. What was...
It's been a while. It's been like 3 weeks, I think, since we last recorded. Our last recording was a guest episode. So, I can actually go back and look at our blog to find out.
Oh yeah, because there's definitely been a slew of mental health business moments. I think the
last one we talked about had to do with getting fully licensed in the state, but the insurer was requiring you were trying to get a network with an insurer in the state of Hawaii, but they were requiring a physical Hawaii address to grant you in-network status. Has anything come of that?
Yeah, and that's actually what I was thinking about, that there was resolution on that, and they said that it would actually... I feel like I'm having deja vu, but I don't know if I said it for the podcast or not. We can always edit it out, but there was follow-up, and that they said, you know what, it's fine to actually start as a telepsychiatry practice and you don't need an address. And so we're moving forward. I'm waiting for them to send out a contract with next steps. I think I'm very, this is an insurer that pays a % of Medicare rates for the state of California, and I'm hopeful to get the same percentage of the same deal for just the Medicare rates for the district in Hawaii for the same percentage. I'm curious to see how that goes. I do think the other, in case I've mentioned that before, the other mental health business moments have been, we're at the end of February now, and we're still dealing with some fallout for people who didn't know their insurance had changed.
Oh, no way. Okay. I mean, I believe it, actually. Yes way. Do tell more.
Yeah. And so, it is, even though you try to be proactive and check with patients about insurance changes, a lot of times people are not aware. And then sometimes you might have done 10 sessions. 10's probably a lot, because we can usually you can figure it out sometimes in the moment. But, sometimes if you've done weekly therapy and then you've been billing under the old insurance, and then they say, oh, we have new insurance and it's something you're out of network with, then that's a problem for those 4 sessions you did with the old insurance. Hopefully you can go retroactively and submit under the new insurance, but that's not always the case. And if the new insurance is out of network, your patient could just have a lot of money owed. And we have, on some level, it happens no matter what. But we have several cases now that, people who owed a $20 copay, it's now sort of a thousands of dollars type money owed situation. And we're trying to navigate that.
Yeah. I mean, I recently had that happen for myself, where I was charged hundreds of dollars for some visits, some appointments that I had at the beginning of the year. And I was like, whoa, what's the deal here? And then it kind of corrected itself, not corrected myself, but it hit my deductible, and it's like, okay, the visits are a lot cheaper now. Which, is always confusing every year. So it's understandable.
Yeah, right. Even a product manager for an EHR that does those eligibility checks and is well versed in deductibles and copays and co-insurance, it's like you're kind of used to one number, and when it's more, especially given how dysfunctional the healthcare system is, your mind tends to immediately go to who's screwing me. But
Yeah. I mean, I usually blame the insurance company, but it's always different. All right. Well, this has been another fun little episode. Anything else you'd like to say before I wrap up?
No, yeah, it's I think 2025 is going to be an exciting year, and we've got excited for lots of stuff we have coming up. So that good energy.
Yeah,
going.
you wanted to talk about some new and exciting things, and I said, wait. Let's solidify some of these things. I'm excited too. I want to talk about them, but just stay tuned, and we'll be. I'm sure we will be talking a lot more about those things in future episodes.
Fair enough. That's why I have you here, Parker, to keep me in check.
Sounds good. All right. Well, thanks for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. As I mentioned at the top of the episode, expect the next episode to come out in a couple of weeks. And if you have any questions or you're interested in being a guest on the show, we just had Christina Nail. Great conversation that came out a couple of weeks ago where she's a licensed sex therapist, and it was just a really interesting talk. I do recommend going to go check that out. If you're interested in applying to be a guest, similar to like she was a guest on the show, send us an email at sitandstay@ripsytech.com. All right, Tom.
Awesome. Thanks, Parker.
See you next time.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.